Great. Well, I'm Judith Hunter and I've been asked to talk to you about breast reduction, and I'm a plastic surgeon who mainly does breast reconstructive and aesthetic surgery. Breast reduction involves moving the nipple up into a higher position and taking wedges of skin and breast tissue away to make a smaller lifted breast, which looks a bit more youthful. It does mean, however, of course, that you have a breast that does have scars on it, and they are permanent scars. Breast reduction takes roughly about 3 hours for most people. It's a general anaesthetic, so you're asleep. Normally we put drains in and they generally come out the following day. Most people stay in hospital about a night. I do like to put all absorbable stitches in, which means that they're easy to care for, and then glue over the top to waterproof everything. You would need to wear a post-operative bra, which we fit you for 6 weeks, day and night. And I prefer people not to be going to the gym or heavy lifting for that time either, just to allow everything to heal. Most people take about 2 weeks off work, for example. In terms of risks and complications, it's a general anaesthetic, so rarely there can be problems with blood clots in your legs or in your chest or a chest infection. We do our very best to prevent you getting those problems. One of the best things that you can do to help yourself is to walk around as much as possible afterwards. Then there are issues to do with any operation, which includes bleeding, going back to the operating theatre potentially if there is a problem with bleeding, which we pick up quickly, and one of the reasons we keep you overnight is so that we can pick that up. You may end up needing a blood transfusion if that happens. It's pretty uncommon though, it's about a 1% risk, something like that. Infection is a risk as well, but again it shouldn't ruin the whole result. It's unlikely to cause you major problems. Scars are something that can be a bit problematic. They are permanent, but they do settle with time. But you need to leave them about 18 months or so to really see the final result. I do give you advice regarding moisturisation and massage to really help with the scars as time goes along, but you mustn't do anything with them until everything's completely healed in about 2 or 3 weeks. So the scars generally for most breast reductions are around the nipple, straight down, and then underneath like an inverted T shape. It's quite challenging, I think, to get a nice shape without adding all those scars for most breasts that I'm seeing. Then just to say that no two breasts are absolutely identical ever, and so they're not going to be identical afterwards, but I'm very careful to measure everything, and also to sit you up in the middle of the operation just to check that the symmetry is as good as we can get it. There are issues also with the nipples potentially in the future. You need to be aware of that. So if you're still thinking about having children in the future, then there can be an issue with breastfeeding afterwards. The nipple itself can have not enough blood supply when we're moving it up into its new position, and so very occasionally that can actually die. That sounds awful, and it is the worst complication that can happen, but it's about a 1 in 600 chance, so it's rare, and it does tend to be in those patients that have extremely large breasts that we're lifting long distances. If the worst did come to the worst, being also a breast reconstructive patients for ladies that have breast cancer, I do make new nipples. That is something that could be addressed should it be a problem. People do notice that the nipples are a little bit different in terms of sensation often afterwards as well, and that can mean you have a bit of a numb nipple, or it can mean that your nipple goes a bit oversensitive, and it may be different one side to the other, so that's just something to bear in mind and is actually quite unpredictable. Generally the aftercare involves you being seen in clinic the following week, but we're always on hand should there be problems, and we can arrange to see you at any point. But generally I'd see you every week for a few weeks to make sure that everything's all healing up adequately and that we've got any dressings that need to be done, and then generally I'd see you at about 6 weeks and then further in a few months' time. As I said, most people take a few weeks off work, but that's sort of depends on the sort of work that you're doing. But I'm very happy to see you and hope I can help.